Hi, my name is Patty Kennard. I'm the clinical nurse specialist for Brain Spine Hospital. We're going to do a video here for the appropriate CHG bathing per our OSU protocol. So evidence suggests that bathing patients with either a 2% CHG cloth or a 4% CHG soap is effective in reducing healthcare associated infections. The healthcare associated infections are costly and detrimental to the outcomes of our patients. Previously, only the high-risk patients, such as those going to surgery, those that have lines or tubes or drains, or a Foley, were in the ICU, were receiving a CHG bath. In 2019, we initiated a new bathing process throughout the organization that all patients every day, with the exception of women and infant, will receive a CHG bath unless contraindicated. There are two options for bathing patients with CHG. The first one is the 2% waterless bath product, which we could call our CHG wipes. The other product we have is the 4% CHG foam soap. And with the foam soap, we've implemented what we call a HIBI universal bathing system, otherwise known as our disposable basin, to go along with the soap. When we talk about basins and why we implemented the universal bathing system, the old basins that we have, we will not use for any baths any longer. The basins can be a potential source for transmission of multi-drug resistant organisms and will need to be thrown away after each use. Therefore, that's not environmentally or economically friendly. So that you should not see ever giving a bath with a basin any longer. With this being said, and having two ways to give CHG baths, your units have decided which products they will use. Some use both, some will only let you use one or the other. So you will need to know which products your floor uses and how to use each one appropriately. And that's what we're going to discuss here next. The general information about giving a CHG bath, again, all inpatients receive a CHG bath daily unless they're contraindicated. And the contraindications include a CHG allergy or the day they're receiving radiation. So with that, we would use the Alavesto foam soap. That is a current product we have now for bathing or incontinence care, and that can be used for those that have a CHG sensitivity. The other reason, sometimes the reason we don't give a bath daily is the patient's refusal. If the patient were to refuse a bath, we have to document that refusal. The RN should be notified and attempt to give the CHG bath. If the patient still was refusing, then we would document that a second time, and the doctor would be notified that the patient did not receive a CHG bath. It is really important that every patient every day receive the CHG bath to decrease the chance of infection. So the key points for the 2% CHG cloths, we're going to start with the Sage cloths. You're being seen now the education sheet that is available online, that is through our policy. This is the tip sheet for it. So some things, these are cloths, they have to be disposed in the trash. They cannot be flushed. Our sewer system cannot handle these wipes in the toilet. So please let your patient, your family know, give them a trash can if they're doing their own bath with the wipes. The cloths are safe for superficial wounds, stage 1 and 2 pressure injuries, and closed surgical incisions. If your patient has a Foley catheter, the CHG cloths are used to clean the urinary catheter tubing from insertion to 6 inches below the site. There are specific uses of the cloths. There are 6 cloths in the package, and there are recommendations for how to use the cloths. For the face, we would never use CHG, any product of CHG on the face. So you can either use just water on a washcloth or we still do have our wipes, the blue wipes that we use for perineal or for incontinence care. That is appropriate for the face also. Once you have the face clean, the first CHG cloth is used for the neck, shoulders, and chest. The second one is both arms, both armpits, and both hands. The third one would be used for the stomach, groin, and genitals. The fourth one is for the right leg and foot. The fifth one is for the left leg and foot. And the sixth one is for the back and buttocks. Real important, you only have 6, so to use them appropriately and not recontaminate. The other product that we're using is the 4% CHG Hibiclens. That again is a soap, and that's why we need water with it, and we need some towels to dry. So this has 10 washcloths in it. There's nothing else in here. You fill your basin with warm water. With this, the first washcloth could be used for the face, and then you're going to use the other 9, some of them for washing and some of them for rinsing. Again, you would never dilute the CHG foam soap. It has to go directly onto the skin or directly onto the washcloth. Do not dump it into your basin. That dilutes it, and the CHG property is no longer effective. So really important that we're applying it directly to the skin. It is a soap, so it doesn't need rinsed. After you've lathered it all up, rinse it off with some of your washcloths and then towel dry. For the wipes, I forgot to mention, they do feel a little sticky. You're not, don't wipe them off when it's done. They have to dry onto the skin. When you're gathering your supplies for the foam soap, check your room first. If there's already a bottle of the foam soap in there, don't get another one. This should be good for about 3 to 4 baths. So kind of check your room first so you don't take extra in. If your patient prefers to shower, they can use either product for showering. If they're going to use the wipes, if that's what your unit uses, they can shower with the Alavesto soap first and then completely dry. And then once they're completely dry, use the cloth as directed and go back over the skin until it's dry with the wipes. If they prefer to use the foam soap in the shower, they can jump in and get wet. They need to step out of the stream, apply the foam soap directly to their skin or to the washcloth again. And then when they've all sudsed up and they're finished applying, jump back into the water stream and rinse, and then pat dry. Again, not to dilute it, it takes away the properties of the CHG. So for documentation, this is what our documentation looks like. And you can choose a full or partial. If your patient has any kind of drains, tubes, or lines, they must receive a full CHG bath daily. So you can choose that. This is highlighted the example of the bath chlorhexidrine soap and water, which is our CHG. And so you either choose the soap and water if you're using the foam soap, and or the CHG wipes if you're using the wipes. And that is both of our products that we should be used successfully on each patient. Thank you.